Good afternoon, and after a heavy lunch, we are here for this session, and my talk will be achieving quiet eye after cataract surgery. So, this talk basically is on the medical management of post-operative medical management of cataract surgery. So, what are the common complaints of a patient after cataract surgery? Is ocular discomfort, irritation, redness, watering, foreign body sensation, and fatigue. And it is seen in almost 8.3% post-operatively. So ये आगे पीछे नहीं हो रही slides. Yes.
It's moving here.
Okay. So what happens is after the cataract surgery is done, there are structural inflammation and chemical changes that happen during the surgery that leads to a lot of inflammation in the eye. And these structural changes are seen at the surface of the cornea, where there is a central and the paracentral non-epithelial thickening, which is compensated by the central and paracentral epithelial thinning. So there is loss of epithelial surface, which happens after surgery. And this can be because of the various chemical effects of the various saline and solutions we are using during the surgery. So it also causes changes in the tear film stability, which is seen to be worse after the surgery, which is being evident because of the increase in shimmer time. The corneal sensitivity thresholds are changed, and the corneal staining pattern is also changed. So various ocular parameters like tear film instability, they become worse after the cataract surgery. Even the meibomian gland function is affected because of the surgery, which leads to the structural, this is because of the structural changes within the meibomian glands, that leads to the ocular discomfort and dry eye. So cataract surgery basically induces a surgical inflammatory response that disrupts the blood-ocular barrier. There is exposure of the lens protein. Also there might be remnant of viscoelastics, and there might be some ingress of the extraocular fluids like blood into the anterior chamber. That causes a sequence of inflammatory cells entering and cytokines released into the aqueous humor, leading to uncontrolled inflammation and lead to complications which can lead to further deterioration like cystine macular edema, posterior synechial, intraocular pressure is increased, corneal edema, hyperemia, and so many other things, which leads to delayed in visual outcomes. So chemical changes that happen secondary to surgery leads basically is because of release of cytokines within the anterior chamber, and that leads to ocular surface damage. So what is a quiet eye that we want to achieve is basically good corneal integrity without redness, no complaints of discomfort, without irritation of the conjunctiva and sclera. And this is, we can achieve by limiting the amount of structural damage, inflammation, and chemical changes. So this is very important when we are using modern IOLs, because any loss in structural integrity or any increase in inflammation can delay the surgical outcome and will affect the performance of the multifocal and EDOF lenses. This leads to a very unsatisfied patient. We don't want an unsatisfied patient. So our ultimate aim will be to achieve a quiet eye, and by controlling the inflammation and surface integrity, we can achieve that. So a good post-operative regimen will be one which will have the effect on the one which will lead to the maximum anti-inflammatory response. So steroids and NSAIDs are very effective in control of this inflammation. Preoperative use of NSAIDs is shown to decrease the post-operative inflammatory release, marker release, and post-operatively use of corticosteroid at least for first 2 weeks, and then NSAIDs in addition for another 4 weeks will help in decreasing the amount of inflammation and achieving quiet eye. So NSAIDs, we all know, are the non-steroidal analgesics. They are alternative to steroids without the side effects of steroids, and they inhibit cyclooxygenase pathway, that is prostaglandin synthesis, and suppresses the release of chemical mediators, prevents inflammation and pain. The common NSAIDs which are available in the market are flurbrufen, Cataract, diclofenac, bromfenac, and napafenac. Of this, what I prefer is napafenac, which is a prodrug. It is highly lipophilic. So lipophilic nature increases the corneal permeability without the need of any buffer, and where it enters into the aqueous humor, converts into a active component which is amphenac, and it inhibits the cyclooxygenase pathway and thus helps in decreasing the release of prostaglandins and controlling inflammation. Along with NSAIDs, there is another factor which is important, that is the preservatives, and most common preservative used is BAC. And BAC is not a very good preservative. We all know that BAC definitely helps in preserving the solution in the bottles, because it has very good antimicrobial activity against the gram-positive, gram-negative and the fungi. And it also helps in improving the penetration of the drugs. But BAC is also affecting our corneal surfaces. It has a detergent-like property which affects the phospholipid layer of the cell membranes, and also it disrupts the tear film. Leads to ocular surface damage, loss of goblet cells, and also disrupts the corneal epithelial barrier. Hence, leads to inflammation. So BAC, when we use, it cannot be neutralized by the mammal cells, and it acts out as a constant irritation because it is not being absorbed fast. It stays there for 1 week. So the effect of BAC stays for 1 week, and it's long-standing, where the loss of epithelial cells leads to tearing, photophobia, and burning sensation after surgery. And even the lowest of the quantities of BAC can lead to some amount of prostaglandin release in our ocular tissues. This is all slides which show that the effect of BAC on ocular surface. Even in the lowest concentration, that is 0.004, it leads to a significant reduction in the tear film breakup time. So BAC as a preservative may lead to complications and issues with wound healing, comfort and vision recovery. So BAC as a preservative may hamper the achievement of quiet eye. So what can be done is use an alternative to BAC, and to my knowledge, if we use stabilized oxychlorocomplex, that is a purite preservative, that helps reduce this post-operative BAC complications, because it's a very stable component which is bactericidal, fungicidal and virucidal. And once it is instilled on our ocular surface, it just breaks into natural components, that is water, hydrogen and sodium chloride. And there is no documented toxicity to mammalian cells because of the use of pyrite, and hence improves the tolerability profile of the drug. And if we combine this pyrite preservative with napafenec, we get a very good very good product which we can use for post-operative management, because that will lead to least inflammation in the eye. Because napafenec is also lipophilic, it does not require BAC to be active, because it can just penetrate the cornea very easily. So napafenec can be very easily combined with this pyrite formulation, and these suspensions can help in maintaining the surface integrity and thus help in decreasing the post-operative inflammation. So what I suggest is that napafenec with pyrite formulation should be also used. That should be the first line of treatment along with steroids, to be used post-operatively to have more and more comfort after surgery. Because napafenec reduces the inflammation and pyrite does maintain the ocular surface integrity. Thank you.
So any questions for Dr. Saurabh?
Thank you, Dr. Saurabh.
Thank you, sir.
Just one question for you. There are so many, with no financial interest, there are so many brands of napafenec available in the market. The same napafenec is there for more than 300 rupees and same napafenec is there for 100 rupees. Which one works better in your experience?
Very difficult question. So I think it's up to personal use of the doctor and the need of the patient. The branded ones definitely are better than that of generic ones.
Yeah, that's the general.
That's the general dictum.
Yeah.
And in that also, if you can just practice a few, like you can take a bunch of few napafenecs, same product, new brand which comes into market, you try it on 4 or 5 patients. If it works the similar way as you are getting your old experiences, then it's fine. You can shift over to the cheaper brand. But if it's not working, then there is no point of irritating our patients after surgery.
Yeah, thank you.
Shift back to your old ones.